Veterinary medicine is a messy business, both physically and emotionally. Vetsplaining is one veterinarian's attempt to explain and understand her own profession a little better. Join Dr. Lisa McFaddin as she delves deep into the medical and business aspects of veterinary medicine.
All right, we are back on the topic of vaccines, and in this episode we are going to discuss core vaccines for both the canine and feline. The American Animal Hospital Association, also known as AAHA, has developed a vaccination guideline for both canine and feline patients. The canine guidelines were recently updated in 2017. The feline guidelines are due to be updated within the next few years, but AAHA and the American Association of Feline Practitioners last created guidelines for feline vaccines in 2013. The authors and contributing reviewers for all of the guidelines are basically the creme de la creme in veterinary medicine. And it's funny to think of celebrities in veterinary medicine, but these are kind of like the rock stars or the Kardashians of veterinary medicine. Basically, these guys know their stuff. As an AAHA-accredited veterinary clinic, Independent Hill follows the recommendations that are set forth by AAHA. And I'll discuss AAHA in another podcast in the future. So if anyone's super curious what they're all about, you'll learn more about it soonish. So all these super smarty McSmartersons sit around in a probably small or medium-sized conference room, and they duke it out until they come to a consensus about what is best for canine and feline patients when it comes to vaccinations. And a major part of the guideline is the idea that there are core and non-core vaccines. So in other words, they divide vaccinations into a category where absolutely every pet should have it versus only pets that have enough exposure should have it. And for our canine patients, those core vaccines are rabies and a combination vaccine that we commonly refer to as the distemper vaccine. And the distemper vaccine really has at least 3 components in it: the canine distemper virus, the canine adenovirus, and the canine parvovirus. Core vaccines for feline patients are rabies and what I call the FERCP, which is just an abbreviation of the viruses, but what we also call the feline distemper virus. And there's no distemper in the combination virus. It's just, we think, owners know what the canine distemper is, so we'll just call it the feline distemper. And the FERCP protects against at least 3 viruses: the feline rhinotracheitis, also known as herpes virus, the feline calicivirus, and the panleukopenia. Non-core canine vaccines include Bordetella, Lyme, leptospirosis, canine influenza, coronavirus, and parainfluenza. And non-core feline vaccinations include feline leukemia, feline immunodeficiency virus, we also call it FIV, feline infectious peritonitis, we also call it FIP, chlamydia felis, and Bordetella. So I'm briefly going to discuss each of these diseases and their respective vaccines. This time we're going to talk about our core vaccines, and then in the final podcast about vaccines, we'll talk about non-core. So if you're interested in more detail, let me know, and I can create another podcast that goes into more depth about something that maybe I brushed over in this one. But in an effort to not bore everybody and to prevent like a 12-hour long podcast, I'm going to keep it somewhat brief. Just so you're aware, there are many animal vaccine manufacturers. Each vaccine type has its pros and cons. And at Independent Hill, we carry and use only Marielle vaccines. Marielle is actually now a part of the company Boehringer Ingelheim, or BI. And when I talk about vaccines, I'm going to mention why I use the Marielle product. And for the sake of time, I'm not going to discuss every other vaccine out there. And if any listener has specific questions about other vaccines, again, I'm happy to answer them. I'm happy to create another podcast. And just so you know, I'm not paid by Marielle, and I have not received any compensation to mention their vaccines. I just personally believe that they manufacture and produce the best vaccines for my canine and feline patients. And also, as a disclaimer, PetWell Partners does not require its clinics to carry and use Marielle vaccines. Every medical director can pick the vaccine that they believe best suits their patient. So first, we're going to talk about rabies. It's a fatal viral infection that can infect most mammalian species. The virus is transmitted through bites, specifically through saliva. It can also be transmitted through blood. And it infects the central nervous system that causes disease in the brain and then ultimately death. And it can take days, weeks, or months for an unvaccinated cat or dog to show signs once exposed to a virus. And infected animals often appear anxious, aggressive, restless, or they have erratic behavior. And some pets can develop what's called the dumb form of rabies. And some pets can actually develop what's called the dumb form of rabies, and they present with weakness, incoordination, seizures, tremors. Wildlife, you'll see this shift in their sleep-wake cycle. So their your classic example is like the raccoon that you hear barking or yowling in the middle of the day. I remember I feel like everything happened when I was 9, but I think that's just when like my long-term memory really kicked in. But there was like a moratorium on waiting for the bus outside of your house because there was a rabid fox in our neighborhood. We would hear it in the morning yipping. And then one day a neighbor caught it under their trash can. And then we were all allowed to wait for the bus outside again. Wildlife, in addition to having that change in their sleep-wake, also lose their fear of people. So that can be extremely dangerous because they can actually then infect people, which is really the whole reason we do the rabies vaccine, right? Rabies is a terrible disease. We don't want our pets to get it, but we really don't want us to get it. The term for a disease that can be transmitted from animals to people is called zoonotic. So rabies is a huge zoonotic virus. And because it's such an awful virus and it can kill people, all states have very strict rabies vaccination laws. And each state requirement is a little bit different. In Virginia, where I'm practicing, all puppies and kittens must be vaccinated against rabies between 12 to 16 weeks of age. And they're given one injection, and that lasts for a year. And then 1 year later, they must be given a vaccine every 1 to 3 years, depending on the product used. In my practice, we stress the importance of vaccinating every 3 years so that we minimize the risk of exposure. And some people ask me, well, can't we do an antibody titer instead of the vaccine? And an antibody titer is a blood test where you measure the amount of antibodies against a particular virus, and in this case it would be rabies. Unfortunately, the state of Virginia does not recognize that as a valid form of immunization. So you cannot, I believe in most states, you cannot use rabies titers as a substitute for the vaccine. And because some people I'm sure are wondering, all pets, that's the 1 pound puppies to the 175 pound Great Danes, receive the same dose of the rabies vaccine. It is almost always 1 ml. And this is law. It cannot be altered. I spent a lot of time and money getting my license, and I would really like to keep it. And unfortunately, no studies have been conducted showing that, a puppy that weighs 1 pound only needs, let's say, 0.1 mils, whereas a puppy that weighs 100 pounds needs 1 mil. And because there's no studies proving that you can give less vaccine to a smaller patient, we can't do it. And So because there's no studies proving that we can titrate the amount of vaccine based on patient weight, we can't do it. Rabies is just too serious, and there's too many legal matters for us to muck with it. It is very unlikely that those studies will ever be done. And that's because FDA studies to get vaccine approval are really complicated. They're tedious. They take years. They can cost millions of dollars. And that's including like the development of the vaccine and then the testing. And a lot of vaccine companies just honestly are not in a hurry to take a product that works well, has very few side effects, and spend a lot of money trying to tailor it to each animal size. So we use the Marielle product called IMRAB3. And it's a vaccine that's highly purified with an inactive virus protein. Legally, all rabies vaccines must be killed viruses. Modified live vaccines are generally very safe and effective, but even if there's this like 0.000000001% chance of that vaccine mutating, that little bit of virus in that vaccine mutating and becoming active rabies, nobody wants to take that chance. All of the vaccines are killed vaccine. This vaccine that we use, the IMRAB3, does contain an adjuvant, and that's to ensure that there's an adequate immune response. And remember, we only use this for dogs. This vaccine uses the same Pasteur-Moreau Cognat, I apologize if I mispronounced that, virus strain that's actually found in the human rabies vaccine. It's funny because most veterinarians have been vaccinated against rabies. Most vet schools require it either before you go or once you're there. And it really just means that when I got the rabies vaccine, I basically got the IMRAB3. It's just put in a different bottle with a human label on it. And because they don't have the same boostering process for human rabies vaccines as we do for animals, I actually get a titer every couple of years. I do it about every 2 to 3 years, which really confuses the heck out of my physician's office whenever they're drawing blood. And I say, hey, can you add on a rabies titer? It's usually about 20 minutes later when they figure out what test they're supposed to run. I received the rabies vaccine in 1999, and then in 2014, I actually titered low, so I had to go to the health department and get a booster rabies vaccine. And I had a veterinarian friend of mine say, oh, you should just give yourself an IMRAB3, which obviously I didn't do, A, because of the legality, and B, because I don't know if there's really any difference between the vaccines. But then when I read that there's really no difference between the vaccines, I feel like it probably would have saved me a trip. But again, we go get the human version. And so for our feline patients, we use the Marielle PureVax, the 1-year and the 3-year rabies vaccines. And these are the only non-adjuvanted feline rabies vaccines on the market. They use what's called a recombinant canary pox vectored vaccine, which really just means it's a super fancy killed viral vaccine that only uses some of the proteins expressed by the rabies virus, and it doesn't use additives, but it triggers a strong, comprehensive immune response to the virus. The 3-year version is actually more potent than the 1-year version, so the short-term reactions like lethargy might be a little more common in your older patient, especially those that are in their teens. So I usually warn people when we start the 3-year rabies for cats. In dogs, the IMRAB 3 has 3 in the name because it's labeled for up to 3 years, but we use it for our 1-year and our. So now we're going to talk about the canine and feline distemper vaccines. The meat and potatoes of the canine distemper vaccine are, again, the canine distemper virus, the canine adenovirus, and the canine parvovirus. Distemper virus is a wicked contagious and serious viral illness that can cause respiratory, gastrointestinal, and nervous system signs in young and adult dogs. And many common wildlife species can become infected with the virus. Animals such as foxes, wolves, coyotes, raccoons, skunks. Lions can actually get it. Seals can actually get it, which is super weird. So exposure is generally airborne through respiratory secretions or saliva. And mothers can actually infect their fetuses with the virus through placental transfer. And signs that you typically see in an infected patient include severe eye and nasal discharge, fever, coughing, lethargy, reduced appetite, vomiting. You can also see neurologic signs like behavior changes, head tilt, muscle twitches, seizures, paralysis. And older dogs that were exposed to distemper as a puppy and survived can develop this like thickened paw pad syndrome. It's very weird. It's very distinctive. Like they're super thick paw pads. Distemper virus can be fatal, or it can lead to permanent damage to the nervous system. Canine adenovirus, there's actually 2 forms, type 1 and type 2. Type 1 is known as infectious hepatitis, and it can cause fever, abdominal pain, vomiting, diarrhea. And type 2 is actually one of the components of infectious tracheobronchitis, which is also called kennel cough. And both viruses are spread through respiratory secretions or contact with contaminated feces and urine. The canine adenovirus 2 is typically what's included in the distemper combo vaccines, and it provides protection against both type 1 and type 2. Parvovirus is a super serious and contagious viral infection that attacks the gastrointestinal tract. So you see vomiting, diarrhea, dehydration, abdominal pain, and it can actually attack your white blood cells. And your white blood cell count can be so low that animals are considered immunocompromised. Infected dogs usually need to be hospitalized for several days so that they can be given supportive treatment while the virus runs its course. So because it's a virus, you can't give antibiotics to fix it, but sometimes you need antibiotics to help because your gut is so severely compromised. It can be fatal, and if pets die from it, it's usually within the first 48 to 72 hours after you start seeing clinical signs. And it's spread through contact with contaminated feces, contaminated environments, or even people. So it's not, people don't get the virus, but if you have a puppy that has parvo, then it can be on your clothes, it can be on your person, and it's a super hardy virus, and it can survive for up to 6 months in the environment. And there are some commercial cleaners that can kill it, but generally we recommend using a 10% bleach solution, and that can actually kill parvo in the environment. A lot of times if you have clothes that were exposed to the parvo virus, washing isn't enough, so sometimes you can bleach it, or sometimes you may even need to honestly just get rid of the items, like the clothing items that came in contact with the animal. All parvo vaccines on the market provide protection against all strains of parvovirus. Some of the distemper vaccines also include non-core items like parainfluenza and coronavirus. Parainfluenza is one of the viral components of kennel cough, which is now called canine infectious respiratory disease complex, or circuit. It's not actually called circuit. I just think it's funny because I think acronyms are amusing in general. So in theory, you might think, great, I don't want my dog to get canine infectious respiratory disease complex. We'll call it kennel cough because it's simpler. So let's do it. Let's put parainfluenza in the distemper vaccine. Well, it does not work very well. The injectable form of parainfluenza is not very effective, so it's pretty useless. And so in my opinion, like if it's not doing anything for your pet, don't give it to them. And to that end, the intranasal is not super effective either. So I realistically, parainfluenza is a component of canine infectious respiratory disease complex, but in my opinion, there's no good vaccine against it. Canine coronavirus is a highly contagious intestinal virus that can cause vomiting and diarrhea in puppies, but it's usually self-limiting, and so, again, in my mind, administration